At this moment, we'd like to do suture removal. So suture removal is a procedure which is done just to remove the sutures, meaning that you had done suturing in OPD or even in theater. Then this patient had to go home, maybe 5 days to 7 days. This patient comes back for removal of sutures. So what I mean is that there are sutures here, as you can see, these here, or stitches or sutures. So you're supposed to remove these. So when removing these sutures, we consider this procedure as sterile procedure. So sterile procedures are the same, the way we start, even the way we go around about these procedures. So the first thing that you're supposed to do is to first of all go to the patient and count the sutures and everything else. So let's start the procedure so that you see how it goes. So as usual, Oscar and washing, and we do that. So this procedure can be done in OPD. Most of the times the patients will be referred to OPD so that you do this procedure. Okay. So come to the patient. Good morning, Mr. Charlie. I'm student number 2. I've been assigned to remove sutures from your arm. Am I allowed to go ahead? Okay. So before I remove, is there anything I can do for you? He says nothing. So at this moment you can proceed. Okay, let me prepare, I'll be right back. So what you need to prepare is just to get the incontinence sheet. You place it under, okay, like that. Then you're supposed to get your methylated spirit. So this is a spirit. You're supposed to get it and put in that galley pot. Okay. Once that is done, meaning that you are good to go. So you can just scrub and remove the sutures. Okay. So what you do, the same procedure of scrubbing. You go 1, 2, then you get soft and do that. Then 1, you lock, and you go outward, circular motion, like this. Then you come here and get this towel. Okay. Then you start inside like that. So it's the same way we are drying hands. So just take note and ensure that you practice so that it gets into your head like that. This is how we do it. Okay. Okay. So you go in like that. Okay. You'll be able to master this as long as you practice. So you do that, then you get this and go. Same way. Then you have to don gloves, the same way we do. So this part is considered sterile, the same way. Okay, sterile. Then this other end you can touch. So we're going to touch this other end here, and fingers should go in like that. Even if your fingers do not go in correctly, just pull, this one. You go in this way as well. Okay. Do that. Okay. Then you can correct now the fingers this side. Okay. Okay, and do that. Okay. So once you do this, what you're supposed to do is you get gauze. So you're going to get a piece of gauze like this. Okay. Then you're going to place this piece of gauze here. Okay, like that. So this piece of gauze is where you're going to be putting your sutures. As you remove, you count with the patient, then you place them there. Okay. So you get this forceps, you put it there. Okay. So this will be for getting the blade here. Then you're supposed to get one swab there. Okay. So you are going to use spirit to clean over there. So okay. So you're going to just get spirit, clean there. You can even do it even more than twice. If you see it's too dirty, you can clean with spirit more than twice. Then my assistant, would you please get for me a blade under? Okay. So it's the bottom shelf. So the assistant to be able to open up the blade. Okay. And pick the blade. So this is the blade you're going to be using. Okay. So once this is done, you're going to get now this blade. Okay, so if you're left-handed or right-handed, you can choose which one is comfortable for you. Okay, so what you're going to do now is to pick this piece of cotton. So ensure that you lift it up, or this piece of a stitch. So as you can see, you're supposed to have this part exposed. Okay, let me just lift it properly so that you're able to see. So lift it up like this, then ensure that this part is exposed, this part here, so that you're able to cut. Don't cut up here, but you're supposed to cut below the knot. So below the knot is here, so that's why you cut just below the knot like that. Okay, so like that is cut, then you pull it. Okay, so you're supposed to count with the patient. Okay, so the patient has to know that, okay, there are how many stitches? 1, 2, 3, 4, 5. So he has to know that 1, 2, 3. So he's got 3 stitches. So he's supposed to count with himself. I've removed 1, so he has to see, okay, 1 stitch is out. Then again, you go, you put together that part. Okay, this piece is supposed to be together. Okay, then you lift up and then expose this part here. Okay, ensure that you're careful, you don't cut the skin. So as you do that, okay, you do that, then it's out. So you say 2, the patient will be able to see that this is stitch number 2, so you place it there. Then you go to the third one. Okay, you go, you expose that part, then you cut there. Okay, so this is stitch number 3. So you didn't tell the patient to say that, okay, you had 3 stitches and they are all out. So the patient should be able to confirm with you that, okay, there are 3 stitches here, 1, 2, 3. Okay, so this goes in the sharps box. Okay, this will go for sterilization. So the patient has to know 1, 2, 3. So there are 3 stitches that you have removed. Once you do that, you should also clean. Okay, you should get methylated spirit and also clean the site where you have removed. So you go and clean. So you can clean this side, that side, until this area is clean or it appears clean to you. Okay, so that's what you do. So at this moment, you even tell the patient to say, okay, thank you very much for allowing me to remove the sutures. I've removed 3 sutures or 3 stitches. Okay, so at this moment, you're allowed to go home and continue cleaning the site where I've removed the sutures. So you have to go now to the sister in charge and report that sutures or stitches have been removed. So the patient had 3 stitches and they have removed 3 stitches. The patient has also confirmed that 3 stitches have been removed. So thank you very much for allowing me to do this procedure. So you can also remove the gloves. Then lastly, you hand wash. So this is what you do with suture removal. So suture removal is very practical. You can do it in OPD or maybe even in clinics. So it can be done, I can say, in most of the settings. So practice the procedure so that you can be able to have an opportunity to do the procedure. Thank you for watching.